Someone once told me that life moves in delicate ripples, and that when you throw a stone, you never know how far it will go or who it will touch.
We all do what we have to do to survive. You have to do what you have to do.
Serving the Bay Area with all news, all the time.
I feel like I'm soaking up the bad news every time I come home and turn on the damn news.
The Dow today fell about 26 points.
The world's gone crazy.
We've gone from a vibrant economy to a stagnant one that's in the dumps.
The Dow fell 26.
Numbers like this.
Working without a net.
My name is Lorna, and I'm a filmmaker. My mother says that by the time I turned 3, I had already taught myself how to read by sounding out the credits at the end of movies. Since crying for a dirty seagull named Jonathan, I've been hooked to movies, especially to making them and to making my own.
Action.
I've spent my life following my heart and chasing the flicker. Along the way, I struggle to stay afloat, usually one paycheck away from living out of my car. For me, living on the edge is a choice, but for many, it's a way of life.
In the county jails benefits. What we look like? We out here working every day, and we can't get no benefits?
No peace. I said no justice. No peace. I said no justice. No peace. All right.
You hear me? Because it could be you in this chair, could be you with this brace on. You better tell them friend. I told you I'd be back, and I ain't leaving until they take me away from here. Now, justice now. Justice now.
You're listening to Work with Marty Nemko. The topic, issues pertaining to the workplace, perhaps also pertaining to all of us indirectly. My guest, union organizer Rahi Reddy.
Every single human being gets sick, and not every single human being has health care, which is, I think, pretty insane. Because health care has been taken over by corporate interests. You have major corporations like Sutter Health, Tenet Health, who make profits off of healthcare, so profits off of illness. What's been happening in terms of the industry and industrial sector in this country is employers are raising for the bottom line and forcing workers to raise for the bottom of wages and benefits. People want quality health care, and if we could really bring all of ourselves together on this point, because that's really what we're talking about.
To understand the complexities of healthcare, with frequent flyer miles and a borrowed video camera, I traveled to another country, searching for answers. Cuba, an island nation 90 miles from Florida, is a multi-ethnic population of 12 million people, where 60% are of African descent, 95% are literate, and where most people live well into their late 70s. Known for its Spanish colonial architecture, its rolling museum of classic cars, rum, sugar and tobacco, and the triumph of the revolution.
Que en una revolución se triunfa o se muere. Si
It's said that Cubanos speak singing, dance while walking, and woo with a love song. With the goal of exploring healthcare, for 4 weeks, I followed the U.S. Healthcare and Trade Union delegation, a group of American and Canadian healthcare workers who toured hospitals and clinics, meeting Cuban healthcare workers and donating much-needed medical supplies hard to come by in the country. A fusion of idealism and practicality, the Cuban healthcare system is nationalized, so there's one single payer, the government.
Uno de los logros más importantes de la revolución. Hay dos a que la población tiene acceso, que es la educación y la salud, cuya primera premisa es que es gratuita, y dedicar todo nuestro esfuerzo en bien de la salud de la población. Todas las actividades que se ofrecen a la población de salud son gratuitas, se garantizan por parte del sistema nacional.
Tiene derecho a ingresar en un hospital, tenga o no tenga dinero. El dinero a nosotros no nos hace falta. Hay un hospital oncológico. Toda la persona que tenga cáncer ingresa allí y es atendido sin dinero, gratis. Si hace falta un trasplante, se le pone riñón sin un centavo, aunque sepamos que se va a morir.
Considering that Cuba is a third world nation, everyone has free, universal access to healthcare. There is an amazing dedication. People in the healthcare system, both the technicians, the nurses, and the doctors, who are really driven by the determination to serve people and to make sure that their entire country is a healthy country, a strong country.
Aquí han habido niños muy graves que han necesitado sangre y eso lo han dicho por la radio, y al otro día nos hemos presentado del grupo ese una cantidad que después sobramos. Nos extraen la sangre y el niño se salva.
Primary healthcare is accessible through neighborhood-based medicine. Everyone has a family doctor they see twice a year, and doctors live in the same neighborhoods they serve.
There's a doctor for every 600 or 700 people. The family doctor knows the healthcare needs of each person and each family in the neighborhood. We visited a family doctor unit, just a little house, and the doctor there had on the wall the map of the area that her clinic covered. It was just 6 blocks. We also saw a chart of all the people who were covered by the clinic. There were 582 people, there were about 190 families. We knew how many people had asthma, how many people were alcoholics.
The system also gives special attention to elders in the community by providing comprehensive care.
one of the things I've been impressed with is the way old people are treated. The nursing home has a number of functions. It serves as a daycare center, it serves as a clinic, it serves as a residence. But most amazing thing of all is that is the number of staff that were in this nursing home.
The second level, it's a hospital.
El equipo se llama el EMAC, que es el equipo multidisciplinario de atención gerontológica. Está compuesto por el geriatra, la licenciada en psicología, la licenciada en enfermería, que soy yo, y la trabajadora social. Este equipo trabaja unido al médico de la familia. Este médico de la familia nos capta al anciano con problemas. En el centro tienen su cuidado en especial por el médico y la psicóloga, su aseo personal, su comida a su hora, y tienen sus actividades. Que el anciano no debe estar solo en la calle, por una persona que lo quiera, que lo mime. Es mía. Yo la capté, Estaba flaquitita y la capté. Mira que bien está.
How old is she?
18.
80?
El anciano se siente bien. Este anciano nace. Es como la flor que germina cuando le echamos agua y va creciendo. Se siente como si estuviera joven.
It breaks my heart to see how little these people in Cuba have, and yet they take care of their patients with dignity.
We went to this psychiatric hospital in Havana. For almost a century, it existed before the revolution as a psychiatric hospital, but it was more like a house of horrors. The conditions there were really incredibly horrible, really unspeakable.
This hospital was built not to just house psychiatric patients, but people who were perfectly normal, but because they were black and elderly and didn't have money, they were put in this hospital too. And that was the case until 1959, until the revolution.
Open, airy, innovative place that I've seen in a long time, especially considering they don't have money for drugs.
Linda, y vamos, y vamos.
This psychiatric hospital has had to develop alternative forms of treatment, and they rely very heavily on occupational therapy.
Here, using other forms such as work and sports and things that give people self-confidence and pride, it's kind of amazing.
And it really is an amazing feat to provide health care to the most vulnerable people in society, specifically people who are mentally ill.
Before the revolution, Cuban society was racist, classist, and corrupt, a playground for rich foreigners. Much of its economy was controlled by the United States, and most Cubans were poor and uneducated. With no way out, Afro-Cubans died in their 40s, and infant mortality rates were above 60%. Conditions in Cuba were ripe for changes when people like Che Guevara and Fidel Castro came into the picture. On January 1st, 1959, with the support of most people, the Republic of Cuba, a socialist state, was created. Cuban citizens were granted the constitutional right to universal health care.
The United States government has maintained a really combative policy against Cuba. I think it's because the people who run our country can't stand the idea that anybody else might want to go and take a different route.
Even if there were only one communist on the faculty of one university is one communist too many.
America's fear of a socialist Cuba grew, disintegrating U.S.-Cuba foreign relations.
A strict quarantine on all offensive military equipment under shipment to Cuba is being initiated. It shall be the policy of this nation to regard any nuclear missile launched from Cuba against any nation in the Western Hemisphere as an attack by the Soviet Union on the United States.
From the Bay of Pigs and the Cuban Missile Crisis evolved the U.S. trade embargo against Cuba.
El bloqueo se dice una palabra que de otros lugares no se entienda bien, pero nosotros esa palabra no la sentimos muy fuerte. Cuando se nos enfermaron pacientes con la epidemia de dengue, nosotros tuvimos en pocos días como 300.000 enfermos. Esta enfermedad se transmite por el mosquito que transmite el virus. Bien, esta sustancia para eliminar el dengue estaba disponible en Panamá, pero como resulta que esta sustancia no es sustancia elaborada en los Estados Unidos, se prohibió su venta y entonces tuvimos que ir a buscarla a lugares mucho más lejanos. ¿Y sabe dónde fuimos a poderla encontrar? En Japón. Esto implica no solo que nos costó mucho más, sino que demoró mucho más tiempo en llegar y evitamos más muertes.
Y estamos necesitando constantemente vitaminas, minerales, antiinflamatorios, analgésicos. Y el bloqueo es el que no nos deja que todo eso entre a Cuba con la facilidad. Y a veces hay un paciente grave y hay que mandar a buscar un medicamento a otro país por culpa del bloqueo y se nos muere.
Está planteado que un medicamento fabricado en los Estados Unidos no se nos puede vender. Ese es el bloqueo que a nosotros nos afecta.
After the collapse of the Soviet Union, Cuba experienced a depression called the Special Period.
El garantizar la salud de la población se ha hecho un problema más difícil aún, porque las dificultades económicas han implicado que hemos tenido mucho menos recursos para cubrir las necesidades. Que a veces no tenemos el medicamento ideal, pero se puede utilizar un sustituto para evitar que se nos muera un paciente que no se tiene por qué morir.
One of the main problems that the Cuban people are facing right now is that they've gone to a two-currency economy, which means that there are pesos, but there are also dollars. That means that a tour guide will make more money in a year than an open-heart surgeon. That's causing quite a problem. Why be a doctor when you can lead tourists on a bus?
Living through the special period while holding on to the ideals of the Cuban Revolution have been difficult. Still, Cuba and its people survive.
Nosotros sí somos muy humanos. El cubano es muy familiar. Nosotros siempre queremos tener un recuerdo para seguir las relaciones esas.
Cualquier norteamericano que visita nuestro país se da cuenta que no hay ninguna animadversión el pueblo de Cuba contra ningún norteamericano y que se tratan con mucho cariño, con mucha afabilidad.
As poor as this country is, despite the scarcity, the people of Cuba had to decide what they were going to sacrifice. Healthcare and education were places they were not going to sacrifice. And so the healthcare system has been maintained.
Enfermedades infecciosas, la desnutrición, las diarreas que nosotros lo habíamos controlado se mantienen controladas. Se mantiene la mortalidad infantil sigue disminuyendo, la expectativa de vida sigue aumentando.
Hemos visto los esfuerzos que ellos pasan para mantener el nivel de salud bien alto, pero yo creo que si el bloqueo se levanta, esta gente podría aquí darle un mejor tratamiento a las personas enfermas y tener un sistema de vida más cómodo.
La salud es lo más importante. Sin salud no hay nada. Si tú no tienes salud, no puedes trabajar. Si no hay salud, no se puede estudiar. Si no hay salud, no hay un desarrollo en el país. La salud es el factor fundamental para el ser humano.
Por eso yo soy cubana y me muero siendo cubana. Por eso yo soy cubana y me muero siendo cubana.
Nosotros somos potencia de salud. Nosotros seguimos firmes. Lo que nos haga falta, graduando enfermeras, graduando médicos, graduando maestros.
Y es la música cubana la que quiero yo cantar. Nadie me podrá arrancar del suelo donde nací, pues no hay nada para mí.
Y que si no nos hemos rendido hasta ahora, nosotros no nos pensamos rendir.
Por eso yo soy cubana y me muero siendo cubana. Ay, 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 ay.
Traveling in a country that guarantees its people health care taught me a lot. Considering that there's no money, that there's still racism, and that the embargo continues its chokehold, it's amazing that Cuba has made phenomenal advancements within 50 years. During my visit, I got sick and was bedridden. When the hotel's housekeeper didn't understand why I couldn't go to the neighborhood family doctor because of money, that's when I realized that Cuba's healthcare system is successful because Cubans believe that everyone has the right to healthcare. I wonder if they'll feel the same 50 years from now. Preparing to return home, I wondered, if the tables were turned, how would my family do living in a system like Cuba's? And where would they be better off?
Life so precious, protect your essence against all odds to come back to essence. Can you feel it?
My name is Evelyn Shepard. I'm 62 years old. I'm originally from New York. There were 5 of us, 1 brother, and 4 girls. Cindy was the baby. After my mother passed away, my grandparents took over. My grandparents worked every day, and I grew to love work. Working is very important. You have to get up and you have to take care of yourself. No one else is going to do it for you.
Those people who don't have health insurance coverage, those who don't have good coverage, those who want improved coverage, or they want prescription drugs if they're elderly, they want lower premiums if they're working. So I think people are concerned about health care.
I'm a preschool teacher of 32 years. I'm very dedicated to my job. I have 2 children. They have brought love into my life, and they are the love of my life. Lorna, my daughter, she's the youngest. My son, Joseph, is the oldest. He's a very bright young man. He's a very hard worker. Whatever he does his best.
I learned from my mother to work hard, watching her work hard, going to work every day. I'm a forklift driver / material manager for a company that makes furniture. The materials that I get for my coworkers are arms, legs, cushions that they assemble. I started off as an assembly person, but worked my way up to try to make more money. It's a low-paying job. I only make $10 an hour. The company only offers low medical benefits. What is it like to have a BS job? It's not fun. You have to work hard. Too many hours and too little pay.
With memories of Cuba still fresh in my mind, I came home wondering about the healthcare in the United States and why I know so little about it. So, I set out to learn about the American healthcare system.
The American healthcare system has never existed. There's never been a system. We've always been this sort of chaotic, semi-regulated combination of insurance companies who sell you insurance that you pay them every month, hoping you don't get sick, but if you do, then they'll pay for part of your care.
For people who don't have access to health care otherwise, the county must provide for it. Now, that's state law, and counties provide for it through the establishment of hospitals like Highland Hospital. These are the public hospitals that serve everyone who walks in the door.
If you get sick enough, you'll get health care. If you show up with a heart attack to any emergency room, you'll get treatment. You know, if you show up at the county hospital with cancer, you'll get chemotherapy.
Any poor person can present in any emergency room and expect a certain amount of care, but there's not even any guarantee that you won't be billed for that care, even if you're penniless and uninsured.
Our emergency room is the busiest in the East Bay. It's the biggest. It's known for providing care to everyone who comes, and that's what it does.
In general, people rely upon health care insurance to be provided by their employers. It first emerged as a process mainly of unionization. So in the parts of the country that are heavily unionized, we see large portions of the population have health insurance that's provided by their employer. In the parts of the country that are not heavily unionized, we see the standard does not necessarily include health insurance coverage.
I've had an abscess for several weeks now. I'm here today to get some work done on my tooth. Recently I had some bad problems with insurance. I wasn't able to get any, but fortunately I happened to land a good job with some insurance.
The insurance model was called fee-for-service, which meant you paid into this insurance company who covered you, and then if you went to the doctor or you went to a laboratory or you went to an x-ray technician or you went to a pharmacy, you would show your insurance information and they would bill the insurance company for at least a portion of your service.
Doctors would charge per visit or per treatment. So the incentive for them was the more you treated someone, the more money you made.
Okay, which stage am I in?
Boy, you need a root canal. That's about over $2,000.
$2,000. What sort of insurance I have now is not enough to cover the entire bill. It's really hard to get enough health care to survive and be healthy. You have to just bite your tongue, bite the bullet.
Life so precious, protect your essence against all odds to come back to lessons.
You're not feeling it, man.
About 10 years ago, some academic idiots said, oh, the U.S. is spending too much on health care. The way we should control that is to not let there be any profit motive in health care for those who are actually providing the service. So we're going to create this new system called managed care, which all those parts of the health care delivery system are part of a network.
Rather than paying doctors based on the visit when they take care of a patient, where they'll pay a group of doctors a set amount to take care of all the people in their medical groups. Such and such HMO will say, we will pay you for each of our members for each month, and you take care of them.
The person can stay at a managed care facility and get all their care compact at the one facility. They can stay right there. And it's an efficient way of taking care of people.
I sometimes think that our private medical system has private eyes who go and figure out exactly how much you're worth. Because we were worth exactly $7,001, and what do you know? The bills were $7,001.
A lot of the healthcare dollar really goes to fund the bureaucracy within health insurance companies and HMOs.
The worker who loses his job must pay his own way. But how can he without a job?
A proposed East Bay hospital merger hits a major roadblock.
You still owe $6,600 in hospital bills. How do you live?
The heart of this merger is money.
There's this predominance of for-profit insurance companies and managed care systems who make no bones about that their goal is to spend the least possible on taking care of you. Limit what you get the most possible in order to maximize the profits that then go back to their stockholders or their CEOs.
What is happening here is cost-cutting, revenue-raising, in other words, putting the financial bottom line as the top priority in healthcare.
A lot of physicians are leaving medicine because they're unhappy with where the medical system is these days. The freedom to practice medicine as you see fit has really been curtailed over the last 5 years. We'd all like to think that we make all of our medical decisions in the absence of financial considerations, but if it's coming out of your pocket, you're much less inclined to order tests. It's a big deal to refer someone to an outside specialist, for example, that the group will need to pay for.
What I'm actually experiencing firsthand is coworkers who have to fight to get tests approved, to get medicines approved, to get surgery approved, even when their doctors have said, you need this medicine, you need this treatment. The managed care company bean counters deny it.
Certainly, doctors, personnel, tests, they cost money. But in the Kaiser Permanente situation, they actually publicized a $300 million profit, and they're still crying that they lose money.
The strategy of for-profit healthcare is to get money from all of these healthy people and then treat as few of the sick people as you have to.
That's what a lot of these corporations don't want to take care of. Working class individuals, people of color, underemployed. A lot of these corporations, they rather not see them.
Those who've traditionally had excellent medical care and who've had insurance are used to calling up and getting to see their doctor that afternoon for their sore throat, or getting told that the next appointment's available in 2 weeks.
And so the managed care idea has become an idea of how you shortcut the care. The practitioner doesn't ask a lot of questions, because if you ask a lot of questions, you're going to have to treat. It has become a way to say, no, you're not going to get the cardiologist or the endocrinologist, because we don't want to spend that kind of money on you because you came in with a headache. All these other contributory factors, as far as we're concerned, we didn't hear them and we're not going to treat them.
Well, I've been working for daycare for 30 years, and the first medical insurance we had was Blue Cross Blue Shield. Very nice. Once we got the HMO, I saw the difference in service. I saw the difference in medication. It felt like they really didn't care about you. They even gave me the wrong medicine. And I told the pharmacist, this is a different medicine. They told me, well, we don't have the one that you usually get. Taking that medicine didn't feel right. It triggered my asthma so badly. They didn't tell me that there was going to be side effects. When I have an asthma attack, it feels like I'm going to pass out because I can't get enough air. It scares me so much. It feels like I'm going to die. I feel my work is important. I find it very challenging. I enjoy working with young children because the mind is like a tool. What I do teach is very important for them. Alphabets, colors, shapes. Parents think that it's not a big deal, but I think it is a big deal. The simplest things that they learn, they will keep with them. I will continue working with them because it keeps me young. Children, they are our future. The teachers are making nothing.
Let's all say yay again, yay! He's smart, yay!
The proportion of people who have jobs but don't have health insurance is growing. And that's part of the national phenomenon where either their employer doesn't offer health benefits or they do offer it, but it's too expensive for the employee to pay their portion of the premium.
I've been working a long time, for 27 years, and I had medical. The present job I'm on now, they offered us a package on healthcare. When she explained it, it sounded very good. By looking at my check and looking what they're going to take out, I would have to pay $450 a month. That's half of my check. I cannot afford it. I have no medical at all.
The employer-based system of health insurance is not really working well anymore, and employers are trying to find ways to abandon it. I think more and more people are experiencing what is it like to be uninsured. Here in California, 7 million people don't have health insurance.
Thank you for calling Blue Shield of California.
Yes, I'd like to get some information on your Blue Cross Blue Shield. I don't have any insurance myself, and I'd like for you to send the healthcare companies the questions that they ask. Do you have high blood pressure? Yes, I do. Do you have asthma? Yes, I do. I'd like to get some information on your healthcare package. I would love to buy the best healthcare for myself. They're just too expensive. Everything comes out of my pocket. I have been paying for my pressure pills. I've been paying for my doctor visits. I have to penny pinch. I cut out coupons. I have to sometimes cut my pills in half or skip a day so I can have enough to save, for the next week or something like that. When you're young, you don't think about getting old. You don't think about your health. When I was younger, I would love to go swimming. I went swimming just about every weekend. As I've gotten older, my asthma has been a challenge for me. It is a challenge for me every day to go out and work or to go for a walk. I walk a block and stop because I don't want to get an asthma attack. I find myself going into the emergency more, taking more of my medication.
People who don't have health insurance don't get seen, don't get treated early, go to the hospital when it's too late, and die. It's not as clear-cut as saying you have an emergency situation and you don't have health insurance, but they take you to the county hospital and you do get treated. That's much less the scenario than the scenario of not having early diagnosis of medical conditions. That's the fundamental thing of life and death between having insurance and not having insurance. It doesn't mean that if you have health insurance, you won't die. But what it means is the likelihood of your getting the kind of regular healthcare maintenance that's important to prevent disease can radically change the life and death of the person.
Without health care, I can go any moment. I can die any second. I can have a cold today and be gone tomorrow. Health is important if you want to live a good life, if you want to grow old with your children.
It's a systematic way in which people are killed, in which people are deprived of their ability to work and live well. It's a built-in way in which people get poor health care because they don't have the kinds of jobs that others in this country do.
what is it like for a working class person? It's extremely difficult. There's no way of living off of $10 an hour because it's too much of a struggle trying to make ends meet. As time went by, I felt that I needed more medical benefits. I've heard people around in the company who also struggling come in frustrated, talk about the same thing. I spoke up for them and myself to the plant manager. So what they did was they went ahead and laid me off. They just wanted to fire me because they didn't want somebody to speak up for other people and to insist on getting more medical. Here in the United States, it's hard to hold on to a job. Looking in this paper every day and not able to find one, there should be plenty of work out there. Being laid off feels awful. That another person would tell me that we prefer $1 over a human. It's not fun because I'm unable to pay my rent and all my bills. And I've been having more problems with my teeth. I'm in so much pain right now, and I have no choice but to go to a county hospital.
One of the problems of the system we have is that it takes until people who are uninsured get super sick and are just beyond being able to even function till they finally find out that there is an emergency room you can present to, and they end up showing up in the emergency room. What kind of things do they have? Every diagnosis you can think of.
I put off seeing a dentist for so long because of money. Look where I'm at now. My face has gotten so swollen. It sucks having to sacrifice my health for money. I wish I could just pull it right out.
The diseases we see are probably similar to the diseases you would see anywhere, except that we see them 6 months later. The people who've sort of fallen through the cracks, by and large, aren't getting routine health screening and all the basic things to pick up disease early. They're also getting the runaround. We'll see people in our emergency department who've had a bad cough for a few weeks and may have come in once or twice before, but after a couple hours in the waiting room gave up and went home. 3 weeks later, we'll diagnose them with tuberculosis that should have been picked up long before.
I've been here now 4 hours, and I still haven't been looked at. If you have the money, you have the medical, you're able to be seen and get more help.
Number 7, please come to reception room number 7.
Once I got into the examining room, I was given a Novocaine shot. The doctor just grabbed the tooth and yanked it out.
What's really sick and sad is that a lot of what people come in with are things that are preventable, things that if you catch them early are really easy to treat and get rid of cheaply and without a lot of pain, without a lot of suffering. Instead, we have working people, poor people who present to the emergency room in the end stages where they might not even be able to have their lives saved.
Since losing his job, my brother's been struggling to get back on his feet. So he's staying with me, sleeping on my couch. But the landlord doesn't allow that. So Joe has to go.
And my name is Joe Green, and I'm homeless, within 3 days, and I was wondering, would you happen to have any available beds? You know, would you happen to know any, can you refer me to any places? No? Okay, thank you. It's a hurting feeling when you know you have to call to different agencies yourself and be turned down because there's no available beds. What happens when you lose a job? It's called a domino effect. It's always something else happening right behind each other. You first lose your job. Can't pay my bills. Now I'm homeless. I'm struggling too much. Survival is hard. There's nothing easy on this earth.
Falling on hard times because you ask for more healthcare benefits is crazy. But watching your brother's life get ruined because of it, and watching it go from my couch to my mother's to nothing, is worse.
Here I am at this shelter. I'm here because I'm homeless. People shouldn't have to fall through the cracks. We as homeless people consider ourselves not homeless. We consider ourselves just unfortunate for the time being. It's like being invisible. Everyone should have something to be creative about and happy about. It just seems like it's getting worse, and there's not enough compassion in the entire world. I've fallen through the cracks of society, having to live and survive this unfortunate situation. Why? Why should I have to go through this?
For me and my family, struggling has always been a way of life. But watching their health suffer and take a back seat to just surviving is a wake-up call to what life is really like, living without a safety net.
I never expected to be broke at this point of my life. It's a feeling that makes you frustrated. The place that I'm living at now, it's too expensive, but I can't live in the street. I have to penny pinch to pay my rent. I have to penny pinch to pay my medical. I don't know how I survive. I'm at that desperate point. What do I do next? At this point of my life, I'm surprised myself what I would do to survive. I was sewing something when I pricked my finger with a needle. So I washed it off with alcohol and paid it no mind. The next day, my finger was swollen. I thought about how am I going to go to the emergency? I have no money. What am I going to do about this? I'm going to have to take care of this myself. I lined up alcohol, peroxide, everything I can use in my medicine cabinet. I turned my flame on as high as it could go. I used my kitchen knife and I let it stay there until it was red flaming. My heart was in my throat. I took the knife off the stove, held my finger over the sink, and said, damn it, I'm gonna cut it off myself. I cut it slowly. I kept cutting and cutting. It was so painful. It kept dripping blood. The black blood, the red blood dripped out until that abscess fell off. It was frightening because there was a lot of blood that was coming out. I thought I was going to lose my finger. People ask me, well, how did you do it? Why did you do it? I could have never done it. I said, don't say what you would never do. You do what you have to do to survive.
Living through the nightmare my mother calls her kitchen surgery made me grateful that nothing terrible happened to her, that she survived. But it reminds me that not everyone in my family has been so lucky.
My younger sister, who's the baby, her name was Sydney. She was the clown of the family. She kept people laughing, told funny jokes. She was a good-hearted person.
She had asthma all of her life. She went into the hospital with asthma, and they didn't take care of her very well.
The nurses really didn't give enough attention because of not having full medical benefits. She went into a coma. She died in the hospital because they didn't care. She suffered so much. It was horrible.
She passed away because of not having good medical care. They killed her in the hospital. If she had the best, she would have been still living.
I felt like a piece of me was taken away. She's my aunt. She shouldn't have died at a young age.
Knowing that my Aunt Sydney didn't have to die haunts me and my family. It's the kind of hurt you live with, the kind that never goes away. Surviving in the same world that didn't think her life was important is hard, but my mother says that tomorrow is promised to no one, and that life moves on, that it doesn't stop. Being pushed out by high rents and low-paying jobs isn't easy. So, my family and I, we're moving. We're starting over again, even with our backs against the wall.
I live without health care, and I'm risking my life every day. That needs to be changed, because my life is more important than a dollar. People should come first before the dollar.
Healthcare is so much about morality. You know, it's one thing to talk about privatizing the production of widgets, but we're talking about something that involves life and death for people.
We have people all over the U.S. suffering in pain, worrying how they're possibly going to come up with the money to afford the health care they need, and unable to live their lives and be productive members of the community.
There's something very fundamentally wrong, where a person is deprived of their right to live because they don't have enough money for a prescription drug, or because they don't have enough money for a procedure.
It doesn't have to be like this. We need what a lot of other countries have already done, which is create a system where everybody has equal access to health care. That's called universal health care.
Everyone should have health care, from the smallest infant to the oldest woman on a cane. Because somewhere in life, that old person worked and paid the way for everything.
If we can create a system that will give access to everyone, I believe most Americans will support it.
This country should give back to the people that help grow this country. The little people are the ones who make this country run.
Any society as rich as ours has an obligation to provide the basics: food, shelter, and decent medical care for its people.
Universal health care will come someday to this country if people who have jobs, doctors and hospitals, and the uninsured are active in advocating for what they need. The more there is an opportunity for change.
I like to think humanity is going to wake up, that we can have a world where we all work together to cherish the planet and each other, and realize that we have enough resources to go around and have everybody have enough.
We live in the same world. We bleed red. Hopefully people will do the right thing.
It's been a hard, long road. You have to take it one day at a time. Faith is when you have a hope, to have dreams, to succeed.
The key to life is to have good health and live a long life. I may not have medical, I may not have a lot of stuff. I still have hope. As long as you're alive, you will have hope.
A rich person is when you wake up and you're able to see another day. You have to just feel that things will get better. Because I am a survivor, trying to make the best of life.
Life is a struggle, but we can survive as long as you have family. And I am going to survive for them.
Though the story is just a slice of the bigger picture, I know now that healthcare is a human right for everyone, not just for those who can afford it. I also know that profit can't be part of healthcare, and that treating people or saving their lives shouldn't be about money. Because in the end, it's not about money. It's about people. It's about the people you love.
Life so precious, protect your essence against all odds to come back a blessing. Whoa, 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 oh yeah. That I was given, yeah. Oh yeah, now. Can you feel it? So true, yeah. Oh yeah, now. Life so precious. Protect your essence against all odds to come back a lesson. Life so precious. Protect your essence against all odds to come back a lesson. Whoa, 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 oh yeah. So true, yeah. So true, yeah. Why can't we see it?
It's gone crazy. The world is gone mad.
turn on the news and the news is all bad, bad. I feel like I'm soaking up the bad news every time I come home and turn on the damn news. Bush wants to go to war with Iraq, but I don't want to die in this world just yet. A new drug called wet and old drug called crack. The world's gone mad, filled with manure. Da da da, the world's gone crazy. The world is gone crazy. Da da da, the world's gone crazy.
Two large bullets fly.